I'm a GP in Kamloops.
Okay. The question is, why has walk-in clinics become something of a reality for a lot of people? Why are they important?
Well, there are just so many unattached patients, and there are so many people that are just so sick. So you can't have people not treat themselves. They have to go somewhere. You can't have them line up for 8 or 10 hours in the hospital when they're really sick. And so I think you found a group of physicians who perhaps didn't want to invest in their own practice, or they didn't want to do full-term practice, or for whatever reason got together and found out that they had a niche where these people were needing to get care. So we've just carried it on, that's all. And now that there are so few practices in our town, I guess you can say that every week one closes up. I just know that the next week we're going to get all of those docs' patients in to see us. Right now I'm working mainly in my practice, but supporting to keep the walk-in going and trying to get some young docs in to see these patients.
It's just a new way of, it's sort of evolving, but it's a new way of doing business for you, isn't it?
Well, it is. And that idea, I mean, I like the idea today with Galt Wilson's slide saying it's a home for primary care. I don't care what you want to call it. If people, don't like the idea of walk-in doctor, mine is divided in a couple different hallways. And it's so funny, when I work in the walk-in, I have several patients say to me, Doc, you're pretty good. You should actually be like a real family doctor. I said, well, actually, this afternoon I am a real family doctor. I'm working in the other with my family practice. So again, that whole idea that walk-in doctors aren't real doctors, or they aren't providing full scope medicine, or they're not as well trained, I think is something that we have to overcome, and I think it's a reality of the future. I don't think that they're going to be able to say, okay, we'll get rid of the walk-ins and then force people and doctors to go somewhere else. That apparently is happening on the other end of the country in Nova Scotia, where my family's from. Apparently there's some talk from the health minister that they're just going to decide to close all the walk-ins down and force people to make an alternate decision. It would be a disaster for all of British Columbia, but I can tell you it would certainly be a disaster in my hometown, where I would have 30,000 people, sick people, stretched out in front of the clinic.
Wow. The other question is the organization as an association. Mm-hmm. I don't know if you're a member yet.
Yes.
Okay. Why is this important? What does the association give you as walk-in clinic operators? What does it give you that you didn't have before?
Well, what Mike is doing is he's done what a lot of us would like to have seen done quite a while ago, because we have concerns about this, that, or the other. We need to have a voice with governing bodies. We need to talk to policymakers. But then at the end of the day, it's like, what happens to me? It's 5:30, it's 6 o'clock. Anyone I wanted to talk to is gone. So you've got someone that's dedicated himself to putting the time in, will talk to us. Obviously, he's brought this together, get some opinions, and be the voice of people who I think are doing in the trenches right now, providing primary care. And a lot of them are like myself. I've got one foot in walk-in and one foot in family practice, and it all depends which needs me that day, So if he's going to help me prevent from doing the splits and let me stock my walk-in clinic with doctors that are given extra pay for being there, giving some kind of an incentive reward, then I think